Hi, I'm Kimberly Stallo. I'm a certified wound ostomy and continence nurse and the clinical field specialist for Dermasciences. One of our exciting products is Medihoney. Medihoney is a medical grade honey that is very widely praised and embraced around the country and around the world. Honey is a remedy that's been around for centuries. We've rediscovered honey in recent years and have actually discovered that leptospermum honey is very beneficial to wound healing. Medihoney has some unique properties. It has a very low pH and a very high osmotic process. It also has some very unique plant-derived properties that are very beneficial in wound healing. Medihoney is a product that has earned a strong reputation for being able to heal a chronic and stalled wound. It jump-starts the healing process. When you have a wound like this pressure ulcer on the sacrum that has necrotic tissue and it has depth to the wound, it's probably a good idea to use the calcium alginate Medihoney dressing. This allows for the space to be filled with the calcium alginate and the Medihoney to be delivered to the wound bed. What you're going to do is you're going to just clean the wound and then fill the wound bed with the calcium alginate dressing. You probably want to protect your skin, your peri-wound skin, with a skin prep or moisture barrier, and then you can apply an absorptive dressing over the top of it. Notice I did keep the calcium alginate within the wound bed. Again, we don't want the exudates to go onto the peri-wound and macerate the skin. So we're going to then put the absorptive dressing on top and tape it in place so that it is in good contact with the peri-wound. And how often we change this dressing is going to be dependent on the exudates, but I would expect this dressing to stay on and be changed every 2 to 3 days. This dressings can be left in place up to 7 days under compression with a venous stasis or diabetic foot ulcer that's maybe under compression or in a contact cast. So the dressing protocol for something like this ischial tuberosity wound that is covered in black eschar would be to use the Medihoney paste or the Medihoney in a tube, and you just apply about a nickel's thickness to the wound bed, covering about 85% of the wound. You'd also want to protect the peri-wound with either a skin prep or a moisture barrier because you don't want any maceration to that wound. Once you've done that, you would cover it with an absorptive dressing and then tape it in place. You want to be sure that the dressing is in good contact with the wound bed. How often the dressing is changed is going to be dependent upon the wound exudates. You can change this dressing as frequently as daily, but if your secondary dressing is managing the exudates well, it can be changed every other day, every third day, or every fourth day. With a wound like this pressure ulcer on the trochanter on the side where you have a fairly superficial wound and it's all healthy granulating tissue, the honey colloid would be a good choice in dressings. You'd want to cut this to fit. So again, you're going to protect your peri-wound area with the moisture barrier and the skin prep first, and of course cleanse it with normal saline or a wound cleanser. Cut that off a little bit, and then just put it on the wound, and then cover it with your absorptive dressing on top and secure it. This dressing again is going to be changed according to the exudates in your secondary dressing. If it's exudating a lot, then it could be changed as often as daily. I would not expect that with this wound. I would expect this dressing to last probably 5 to 7 days. Medihoney is indicated for chronic and stalled wounds. That includes diabetic foot ulcers, leg ulcers, pressure ulcers, first and second degree partial thickness burns, donor sites, and traumatic and surgical wounds. Medihoney dressings provide gentle, rapid, continuous, and effective debridement. The dressings help to improve healing rates and jumpstart stalled wounds. Medihoney comes in a calcium alginate dressing, a honey colloid, and it comes as 100% honey in a tube. This variety allows it to be used on different wounds and different exudate levels. The treatment of chronic wounds is emerging as an important area in medical science. Dermasciences is a dedicated leader in this area, providing novel and technologically advanced products. Medihoney is our most widely known and utilized product. It's demonstrated clinically safe, effective, and easy to use with all other dressings and medications. For more information on Medihoney and our full line of advanced wound care products, please see the other videos in this series.